how does addiction affect not only the addict himself, but also everyone in his entire family?
Well, as people get more and more involved with drugs, even before they become dependent, their sense of responsibility toward their family and their friends deteriorates. They behave poorly. And what I mean by that is that the things that they would ordinarily be responsible for and care about, they start to let go. They may not pick their kids up at work. They may not shop for food for dinner. They may drink and drive and endanger themselves and their family. So that this irresponsibility becomes a factor as they start to use drugs, which affects the whole family. They may experience a loss of control over their emotions. We know that people who are alcoholic and who abuse drugs are far more likely to be abusive, both verbally and physically, towards their family members, because they have loss of control over their emotions, not just when they're high, but also when they're not using because they're withdrawing from the drug. Someone who is shooting heroin for 3 days and doesn't shoot for a day is going to have withdrawal symptoms. Someone who's drinking every day and doesn't drink on Wednesday because they have an important business meeting is going to be irritable, and they're going to be in withdrawal, and they're going to be impatient and hostile and abusive. So the loss of control over emotions is not just for the period when they're physically high, but also for the period in between they're using. The other way in which it affects the family is that once they're dependent on the drug, that's all they care about. So they'll do anything to support their habit. So then you get the person lying about whether they went to work, stealing money from their family to buy and support their drug habits, endangering the family by bringing drugs into the house and exposing the kids to drugs. So all of those behaviors deteriorate. And so usually you have a situation where on one hand, the family is furious with their relative because of all of this behavior that they're involved in. On the other hand, they're desperately concerned because they know that something bad is going to happen. They're going to get arrested, they're going to get into a car accident, they're going to have a health-related problem, they're going to fall and have an accident. So the families are typically torn between the sense of rage at what this individual is doing to the family and also a fear about what's going to happen next.
Can you tell me what the difference is between enabling and helping?
Well, we talk about enabling when the end result is that the addiction either continues the same way or gets worse. So we say that's enabling. And examples of enabling would be, I've treated a lot of couples where, let's say the guy is an alcoholic and the wife is the one who goes out and buys the booze and the cigarettes. And you say to the wife, well, why did you go out and buy a liter of vodka for him when you know he's just going to sit at home and drink it every night? And they say, but that's exactly the point. He's going to sit at home. He won't be driving drunk. He's going to be sitting at home drunk. We would say that's enabling because it does nothing to change the behavior, which is of drinking. We're trying to help people overcome their addiction. So in this instance, the person is telling themselves that they're trading off short-term safety as a way of justifying helping this person to continue to drink. So I would say that's a pretty clear example of enabling. A lot of times if you're dealing with parents and a young adult, so we see a lot of people in their early 20s, that person's not working, they're not going to school, they have no source of funds on their own, and the parent says, well, I have to pay Jimmy's rent. Well, why do you have to pay Jimmy's rent? Well, if I don't pay Jimmy's rent, he's going to be homeless, he'll be sleeping in a crack house. Well, and when he uses up your money, where is he going to be sleeping? So again, I think it's an example of enabling because it doesn't deal with the behavior that's the problem, which is the drug abuse. It deals with the consequence of that behavior, which is the person's going to become homeless.
What can family members do to help an addict but not enable them?
Well, I think a lot of families that I see have had very little education about what addiction is and how to relate to it and what they can do. And so for many people, the first step is to get more information. That may mean talking to a professional counselor who works with drug or alcohol problems. It may be attending Al-Anon meetings, but usually the first step is to get more information. And what they're going to learn is that a lot of the things that they were doing that they thought were helpful were making it worse. Becoming enraged with their relative typically makes it worse. Giving them money to support their habit typically makes it worse. There are a lot of things that all of our families do with the best of intentions that make the addiction worse. So getting information is really the first step. I think that the second step is having a conversation, if you can, with that person who's addicted. And sometimes you have leverage and sometimes you don't. If you're helping them financially, you have some leverage. If they don't get their check or you don't pay their bills or they don't have pocket money, they're going to come to you and you have an opportunity to have a conversation with them about what you expect and what your concerns are. And most of the time it starts off with the discussion of saying, you know, I care about you, but you're addicted. You have a problem with drugs or alcohol, and these are the things that tell me you have a problem. I mean, different families need different things. At Promises, we try to individualize our family treatment. So each client who comes in gets an individual therapist, and each family of the client gets a family therapist. And both of those therapists work with that individual and family all the way through treatment. Most programs are not set up that way. Most programs have a psychoeducational group or a couple of days of education about addiction that they offer to the families who come in for treatment. And for most people, that's simply not going to be enough. It's very hard for family members to change their behaviors. And so, you know, we think you have to do more. So we have psychoeducational groups, we have this individual family therapy process that really supports change.